Most people think of the pelvic floor in terms of Kegels, but did you know this area can actually be the cause of low back pain, hip pain, and even poor posture? Today I'm going to dive into this topic and discuss how it interlinks in the whole fascial system and how you can support it. The pelvic floor is a group of muscles, ligaments, and connective tissue at the base of your pelvis. And this area, you want to think of it kind of like a hammock. And what it does is it supports the bowel, the bladder, and for women, the uterus. Now, here's something most people don't know. This area is connected by a thin layer of connective tissue called the fascia. Now, to demonstrate what the fascia is, if you've ever had chicken and you go to peel the skin off and you see that white film, that's the fascia, and we have that goes throughout our entire body, including everything that's in our pelvic region. And in our bodies, the fascia goes from head to toe, so it surrounds everything, our ligaments, our muscles, our joints. And when there are restrictions in one area, it will actually, it's like a web around everything. It pulls on one spot and then everything else just starts compensating for it, and you'll get rotations and hip shifts and different areas that start hurting in addition to the pelvic area. In our bodies, this fascia forms a web from head to toe that surrounds every organ, muscle, fiber, everything that we have. And when there are restrictions in one area, because of that webbing, that interlinking that's connected, when that area gets restricted, your body starts compensating in different other areas. So for instance, if you start having pain in the pelvic area, a lot of times it will either come or eventually get to your low back, your spine, your shoulders, and even your neck. So we don't want to think about it as just one localized area. It affects the entire body. According to Mayo Clinic, pelvic floor dysfunction can lead to back pain issues, bladder issues, and even bowel changes. And what I find in my practice is that when I address those restrictions in that area, a lot of those functions that are interrupted can be relieved and improved. So what causes the pelvic area to become out of balance? One cause is sitting for long periods of time. When we sit, our hips can actually get locked up and the circulation is reduced, so the fluid can't get to the area. And then for women, pregnancy can weaken the tissues and cause them to be overstretched. Abdominal surgeries are another big cause of dysfunction in the pelvic region. For instance, you have hysterectomies, intestinal surgeries, you have C-sections, any of those type of surgeries where they're creating an incision, so they're cutting through the tissues and the ligaments and the muscle. So what happens is when the body goes to heal those areas, normally the fibers of the fascia are lined up in a parallel fashion, so that way you have more movement and you can rotate and do different things. But when it's cut into and there's that injury, what it does is when it heals, it lays the connective fibers down in a crisscross pattern. And so when that happens, the movement is restricted. And then, of course, the fluid can't get to the tissue like it should. And over time, it just becomes sticky. And that stickiness creates more of a pull, and it gets more dry because it's still not getting the fluid. And so it just keeps creating more restriction, and then pretty soon everything starts getting shifted. Your hip starts getting rotated, pulled to one side. And what's interesting to note is even though your scar tissue, like the scar might be from here to here in your abdomen, the internal scars can actually run down farther that you don't even see. So there's those hidden scar tissue areas that also need to be addressed and can cause an underlying dysfunction in the area. Even daily habits like slumping in your chair or carrying a heavy bag on your shoulder can create imbalances in the body, putting more stress on the fascia and also leading down into the pelvic floor. The Cleveland Clinic notes that tension can create dysfunction. In my work, I have noticed that different areas of restriction are caused by weak muscles and ligaments, and then also overstretched muscles and ligaments and fascia. leading to hypertonicity. And so what that eventually does is you may feel it in the pelvic area, but it can then travel up into the low back or even down into the hips and knees. You might not directly connect certain issues to dysfunction in the pelvic floor. Many people think of the bladder leakage issue with that, but there are several others that can come with it. One is ongoing groin pain. Another is low back pain that just doesn't go away after stretching. A weak core or that lower belly pooch that just doesn't go away after doing the ab work. And then also upper body problems. Because of the way the fascia is connected and how everything pulls, you can start feeling a lot of problems in the neck and the shoulders, going up into the head as well. Another key piece I see with clients is hip alignment. Many times they'll be elevated and rotated or just rotated. There are certain patterns that get set up, and these patterns can create tension in other areas such as low back pain, and then of course hip pressure, and then also pressure in the pelvic region as well, just because of the way everything is connected. And in time, since the body craves balance and is a compensatory type machine, you start working harder on some of the muscles than the others, and so then different areas get overused because your body's not in balance. For women, life stages make a big difference. For instance, during pregnancy, since the body is carrying more weight, that pelvic area gets stretched, and then after childbirth, then everything has to recover and come back together. Some women experience prolapse, where the organs actually shift downward. Johns Hopkins Medicine points out that the symptoms feel like a small ball, like you're sitting on a small ball, and then also the pressure of feeling like something is falling out of the vaginal area. Some also note changes in bowel and bladder function. Now, I don't treat prolapse, but what I do is help women get back into a structural realignment. So that way the fascia starts getting more give and increasing mobility. And by increasing this alignment, it will help balance out the pelvic area and do what I can to help women find more comfort in that type of situation. Now, this isn't just a women's topic. Men also have a pelvic floor too that supports the bowel and the bladder. And the area is also very important in supporting stability and circulation in that whole area and through the lower body. When I work on men's low back and hip fascia, many times they get a lot more mobility in that hip area. There's more movement there because the fluid is getting through and the circulation increases. So they notice a lot of improvement and reduction in pain in that area. So it shows how interconnected everything really is. Medical experts, including Harvard Health, notice that when men experience a dysfunction in the pelvic floor, they have symptoms such as changes in the urinary patterns, pressure in the area, and a lot of discomfort. I don't treat medical conditions, but by helping my clients, such as male and female both, by getting back into alignment, it helps to increase mobility, take the pressure off of certain areas, and also decrease pain as well. Most online sources point to Kegel exercises, and Kegel exercises are extremely important. But what you need to remember is the pelvic area doesn't work in isolation. The breath work is included, your posture is included, your core, all of that is included, and even your rib cage as well. Instead of just clenching, here's what I recommend for a 5-part whole body integrative approach. The first part is neutral pelvic awareness. So you want to be mindful that when you're sitting, you're not tucking your pelvis underneath and creating an imbalance and strain on your low back and your pelvis that way. Or when you stand, you don't want to excessively curve your back forward as well. You want to keep it in a nice neutral position to where your torso and your upper body is levelly placed over your hips, so that way it has even balanced support. The second part is hip and upper leg stretches. What's interesting to note is when you stretch out the bottom part, such as the inner thighs, the quads, the hamstrings, all of this area, all those attachments come up in the hip and in the pelvic floor area. So by releasing that and opening that up, it also affects the pelvic floor. Now, I did a video on knee pain that goes into a lot of these great stretches that help open everything up in the hip and the pelvic floor area, besides down into the knee. So I will put the link in the description for that, and then I'll also put it at the end of this video for easy access. The third part is a trigger point release with a tennis ball. Now, trigger point is a tight band in the muscle that can create referral pain to other areas in the body. And so by releasing those trigger points, it can decrease the pain not only locally, but in the areas that it's referring to. So what I like to do, of course, if you can find a chair or a stool, something fairly hard. You don't want to use a chair or cushion that is too soft, because that's going to take away the effect of the tennis ball going into that tight band. So what you'll do is you'll start on one side and you'll work very slowly. You don't ever want to force it, because if you try to force the ball and into the muscle, it can create micro tears, especially around the ligament, because it'll get overstretched, and then you're adding to the problem, because then it's just going to create more scar tissue fibers and fascia that haphazardly lays down. So you want to make sure to keep everything in alignment and to increase mobility. So you'll take the tennis ball and just go underneath, and very slowly, because this can be really sore and really tight. And so you'll go in that area where the leg and the bottom of the buttocks meet, and you'll very slowly kind of sink down into it, and you'll feel as your body starts molding around the ball. And you'll just want to take some time. Sometimes you can turn the lights down, because like I say, it can be very intense, especially if you've had a lot of pelvic pain or you've broken your tailbone or anything like that from old injuries. That scar tissue can still be there, creating all those patterns. And what you'll find is eventually when that starts to release, the tension and the pressure will get lighter and lighter. And so then you'll just, as it eventually lets up, then you'll even get into other areas where it attaches down into the leg joints, the hip joints, and you'll just work around those areas as well. And the one I'm on now will, of course, it refers down into my leg, and you'll find there are certain ones that send some shooting feelings down the leg. I mean, that doesn't necessarily mean it's a bad thing. It just means that's a good spot that is getting affected. You do kind of have to be careful with the sciatic nerve a little bit. So if it gets too intense or thing, you want to get off of it and maybe move it just a little bit to come into another area of the muscle. And then what you can do is work inward and outward. Don't roll over it. Like I say, just sink around it. But then you just want to keep moving it in, and you don't want to put it right on the bone, but you want to put it off to the side a little bit where that attachment is. And like I say, let it sink around it. And then eventually you'll feel a difference on one side or the other if you're just working on the one side. So you'll take it, and of course, you want to work the other side as well. You don't want to leave that imbalance in there. So you want to make sure to do the same thing with the other side as well. So you can get it in there, and sometimes it takes some positioning depending on your chair. My chair is kind of small, so if you have a bigger chair, it helps a little bit more. So you just, like I say, sink around it. You go on both sides, and I'm still feeling the tingle in this leg from the releases. And you can go in different areas of it and you just feel it. Like I say, listen to your body, feel for that tension, and then just sink around it. The fourth part is breath and pelvic restrictions. Now, these two areas are very interconnected because what happens is if everything's tight in through here, it's going to start pulling you down. And there's muscles in between the rib cage and between the ribs called intercostal muscles. And those muscles are just like other muscles, expand and contract, expand and contract. And when everything is compressed and the fluid and the circulation isn't going in those areas and getting in between the rib and the intercostal muscles as well, those can become tight too. And so what happens is it becomes tighter. It just keeps compressing, compressing, compressing. So when you go to take a nice deep breath, you're like, you can't, it doesn't feel like you can breathe from your full abdomen and get the full airflow in your lower part of your body. So it's very important to be very conscious of that. Stretch this area and open that up as well is very important. I do that a lot with my clients. I not only work on the back, I work on the sides, but I also work through here in this area, getting that opened up too, because that has a direct correlation to everything going on in other areas. The fifth part is through strength and integration. Like we've been touching on, you want to remember everything is integrated. You don't want to treat just one area as a local area. You want to strengthen your entire core. So things like gentle bridges, side leg lifts, or supported squats are great ways to help strengthen the entire area in the core. So that way your body starts getting more in an aligned balance. So I have noticed in the work I do with my clients, when I take that whole body approach and really focus on integrating all the areas into one and not just focus on one specific area and the whole body starts aligning, the body responds so much better and it improves, and I will start seeing shoulders will level out, hips will level out, and beforehand they may have been elevated or rotated. And when you get that in balance, those strain patterns are removed and they're not pulling on the ligaments and everything anymore, causing that pressure, pain, and tension. So by having all that in balance and creating the spine directly over the hip like it should be, it takes a lot of pressure, especially off the pelvic area and the shoulders and the neck as well. My role is to help clients with fascia, posture, and integrative body work that helps restore balance. I'm definitely not a doctor, and all the information I've shared is for educational purposes only. If you do have serious prolapse or bladder leakage or anything in the area that's very serious, you should always, always, always check with your physician. I'm not a doctor, like I said, and it's very important to get those issues addressed if there is something more serious going on. If this video has helped you, feel free to like, subscribe, and share this with someone that you know that might be in a similar situation. And remember to stay tuned for more self-care tips.